March is National Colorectal Cancer Awareness Month, and with us this morning is Dr. Douglas J. Rivera, a board-certified radiation oncologist with Austin CyberKnife, to tell us a little bit more. Good morning to you, Dr. Rivera.
Good morning. Thanks for having me.
Well, thank you so much for being here. Let's talk first and foremost about colorectal cancer, because I'm not sure everybody knows the definition of it, and what are some risk factors of it?
So colorectal cancer is essentially any cancer or tumor that occurs anywhere after the stomach all the way down to the rectum area.
That's actually a real, our intestines are huge, right? That's a lot of space to be considered.
It is, yeah. The colon system is a very long system. And we want to bring awareness to this. You know, there are screening modalities for it that people should be doing, especially after the age of 50, and now even the recommendations are younger even. But it is, preventable if caught very early, and it is the third most common cancer we see in men and females.
Wow, I didn't realize that it was that prevalent. So it's really important that people pay attention to signs and symptoms. So let's talk about some of those. What would people be looking for possible indications that they maybe need to go see a health professional?
Yeah, so you should be doing the screening, and there are some hereditary things, but for the most part, a lot of these things are kind of, dietary related, lifestyle related. But in terms of symptoms, sometimes people can have just, some bleeding or very dark stools, change in their stools, whether like the size of it, frequency. They can have constipation or diarrhea. Weight loss, things that they're not trying to lose weight, but they can. Those are all kind of worrisome symptoms.
I'm surprised to hear that, because some of those seem pretty mild. I mean, who hasn't, for example, gone on vacation and experienced a little constipation, or, the opposite, something like that? So when should we know that, maybe we should start paying a little bit more attention to it?
Well, certainly things that are persistent and don't go away are more worrisome than having diarrhea just for a couple of days after a trip to Mexico or something, right?
Yeah, you got to be careful with all the fresh fruit. Understood. Let's talk a little bit about how CyberKnife can help for patients who do have colorectal cancer.
Yeah, so roughly 150,000 people will be diagnosed in the U.S. this year. Of those, about 20% will have metastatic disease, unfortunately, meaning that it's gone like from that area to another organ or something.
I see.
Or people that have had it before, it can recur and do that as well. So for cases like that, say the liver is the most common area that these things go to, and CyberKnife is a very effective treatment at kind of a non-invasive treatment of treating lesions that could kind of pop up in those areas.
Okay, all right. So especially for someone who's seen the disease progress, this is really helpful stuff. Yeah. And you guys actually have the only CyberKnife here in Central Texas. So let's talk specifically about what CyberKnife is and what it does.
Yeah, so it's a very unique machine in that it can, with respiration, things like your liver, for example, can move as you breathe, and so that's a hard thing to hit with radiation. So this machine is very unique in that matter, that it kind of target, lock down on that lesion and can move with respiration even. So it ends up
never even
very
thought
focused.
Of this before.
Yeah.
Wow, that's incredible. And as far as traditional chemotherapy is concerned, CyberKnife makes it a whole lot easier to be a patient.
It does, especially for that type of treatment. Rather than going in there surgically and kind of cutting it out. I mean, this is a non-invasive thing. You kind of drive yourself to your appointments to get your treatment, and then drive yourself home. And it can be as much as 5, but usually not more than that, or even less in some cases. So it's pretty convenient and a non-invasive way of treating those type of things. A
new ray of hope for anyone who's been diagnosed with colorectal cancer. Thank you so much, Dr. Rivera, for sharing information with us today.
Absolutely.
Austin CyberKnife is located on I-35 near the Dell Seton Medical Center at the University of Texas. Call them 512-324-8060 or go to austincyberknife.com.